Netcare has shrugged off challenges resulting from the tough macroeconomic environment. The private healthcare group delivered on all operational and strategic targets over the past financial year, resulting in adjusted headline earnings per share jumping 27%. Group CEO Richard Friedland joins us now to discuss the numbers further. Thank you so much for your time, Richard. Of course, a continued improvement there. What are you most encouraged by in these annual results?
Well, thanks very much, Zinati. I think what we're encouraged by is the fact this was the first real year after the terrible COVID pandemic that we were able to return to normal operations and patients return to our facilities. Our occupancies in the last 6 months have increased higher than those of the pre-COVID period. But I think what we were most encouraged by was the fact that despite the very challenging operating environment we're operating under, hyperinflationary input costs, a collapse of the grid, huge challenges with service delivery, interest rates at a 14-year high, we were able to eke out very significant operational efficiencies. Thanks primarily to our long-term digitization program, we saved 104 million rand, thanks to our 10-year-old energy sustainability program. We are now today utilizing 39% less electricity than we did in 2013. And over the 10-year period, we've saved 1.4 billion. We're rolling out a digital platform across all of our hospitals. We're almost complete. And it ends the first phase of a very exciting strategy to begin communicating with patients, sharing their results with them and making them co-responsible and equal partners in their healthcare.
Richard, you talk about a normalization of the environment and that this is the first full year that you're operating free from COVID. But are there any trends from that time that have maybe remained persistent and, of course, that are affecting your operations at this point?
No, not at this stage. And at the time, we were very concerned about something called long COVID.
Yeah.
We think that most of those consequences are able to be treated at a primary care level. Zinati, I will tell you what does worry us.
Yeah.
We're seeing an escalation on an ongoing basis of mental health conditions.
Yeah.
It's emblematic of the enormous stress that South Africans are under. And in fact, people are globally living in the kind of world we are at the moment. I don't believe we have the solutions. Using our data and the rich data we've now got from digitization, we're beginning to understand better if the programs we've put in Akesa are working. Fortunately, they are, but we've got lots of improvements and the data is guiding us. But I would say that mental health is an enormous long-term challenge for all of us. Not just in South Africa, but globally.
Yeah, indeed. You mentioned digitization, and of course, I want to zoom into your strategic projects. They cost you 258 million rand this year. Talk to me about the dynamics driving these projects, but also have they started paying off more than your costs in your earnings and margins in this reporting period?
So not more than. We break even in the second half of next year on digitization.
Okay.
And that project will be significantly earnings accretive, not in the 24 year because it happens in the second half of 24, but beyond that. We believe there are enormous advantages of digitizing our clinical records, of digitizing across all of our 7 operating platforms, Medicross, cancer care, emergency services, occupational healthcare, and obviously Akesa in the hospitals. But the biggest advantage for us in this program is our ability to now give patients their records and say, look, here are your records. They matter to you. Play an active role in your healthcare. Yeah. Because if you don't treat your hypertension, your high blood pressure, you will end up with a stroke. If you don't treat your high sugar, your sugar diabetes, you will have a heart attack. Let's help you in that process.
Yeah.
And so we want to develop that relationship with patients, to be able to engage with them, to be able to retain them. And it's been shown in the United States, when patients are engaged, they're 5 to 6 times more likely to stay within a network. They feel they're getting value for money because tests aren't being replicated, and they're more compliant. And so it's absolutely germane to our strategy of person-centered health and care. that is digitally enabled and data-driven. And the data we're producing now is enabling us to improve our safety of our patients within our hospitals and inform our doctors as to what's the best treatment protocols.
Yeah, all right. Well, Richard, as we wrap up the conversation, I mean, you've been very serious about your capital expenditure. You spent 1.5 billion this year, and there's 1.4 billion that has been set aside for FY24. So what do the capex allocation focus points look like for the next financial year?
So most of our capex will go on repairs and maintenance. And we have an enormous portfolio, as you know, 49 hospitals, nearly 70 primary care facilities, 14 mental health facilities, 9 cancer facilities. I could continue. And so most of that is purely on maintenance and repairs. There's a small amount of that will go into expansion capex. About 77 million will go into our environmental sustainability programs. And then we also have another 123 million that goes to complete the rollout of our digital programs as well.
All right. Well, thank you so much for your time and unpacking those numbers that came out of Netcare earlier on, Richard. That was Netcare CEO Richard Friedland.